Communicable diseases are immensely important to the global burden of disease. 31% of all deaths and 40% of all disability-adjusted life years in low and middle-income countries are related to communicable diseases. I'm going to give you an overview of what a DALY is. So DALY stands for Disability Adjusted Life Years. So let's start here at birth. As you move through life, you have a healthy life, but you will have times where maybe you have some sort of illness or disease that stopped your life, or maybe, taken a couple of days away from your healthy life. You have another one at another point in your life, and another one, and maybe here you develop heart disease or diabetes. And so what this is looking at, so the purple are all looking at the disease or disability times in your life. And if you were a healthy individual, say a man living in Canada, your typical life expectancy at here would probably be, let's say, 80 years old. But because of these disease and disability along your way, you've lost some years of life. And so we're not talking about death rates here. We're talking about the number of years of life lost because you had some sort of disease or disability. So in this case, I'm talking about in high-income countries, it would be diabetes, COPD, heart disease. But what I'm looking at here is communicable diseases, and the percentage of disability adjusted life years is 40% of individuals in low middle income countries. 40% of their years lost of life are related to communicable diseases. And so it's estimated that HIV/AIDS has killed about 1.5 million people. TB has been responsible for 1.5 million lives. Diarrhea kills numerous amounts of children under the age of 5, and so does malaria. So some of the concerns of communicable diseases are globalization, the movement of people around the globe, and it's depicted here in this air map or air traffic map among the 500 largest international airports can lead to the rapid spread of an infectious disease, and we are living in a pandemic right now because of globalization. The stigma associated with such diseases as HIV, TB, COVID-19, and others. This is a woman in Liberia who, at one time about 3 years ago, there was a large outbreak of Ebola virus. And this was just this woman in Liberia holding this sign up. And we've seen other signs that I've showed you in a previous lecture with a young Asian woman showing a sign that she's not a virus either. So stigma is related to communicable diseases. Communicable diseases disproportionately affects the poor. There's this vicious cycle, and we call communicable diseases diseases of poverty because they keep people in poverty and they prevent people from getting out of poverty, and it's just a vicious cycle. If you look at this graph here, you look at poverty-related diseases down here, and you look at low-income countries and the mortality rates, you can see the mortality rates, how high they are, regardless. And so these are low-income countries. The high mortality rate is 54%, and the low mortality rate is 40%. There's very little change. High-income countries, our mortality rate is 6.2%. And so what's important to understand is that these can be prevented with treatment and prevention programs. There's an enormous economic consequence of having infectious diseases, and that goes from individuals in low middle income countries trying to pay for medication, having to take time off work. There's a huge amount of enormous consequence. And so these diseases constrain the physical and mental development of infants and young children and reduce their future economic prospects because of that. The communicable diseases have impacts on the adult population because of the indirect costs of treatment, and they have to use a substantial amount of their income or borrow money in order to be able to care for themselves, and it sinks them into more poverty. High rates of communicable disease are also investment impediments for high income countries looking at these countries to invest in. So would you think as a high income country, would you want to invest in a country that's high rates of malaria? Think about their productivity. So you need to think about things like that. And so you have this poverty cycle again, where you start off with someone who has a low poverty income. They have maybe less access to safe food and water, hunger and poor sanitation. They develop disease. They're infected by a communicable disease. They're malnourished. Their workforce is depleted in their country, and the country goes into an economic decline. And so this is the reason that the Sustainable Development Goals are so important, because they are focusing on all the areas that look at health, but also focused on communicable diseases. And so they're very relevant. And lastly, this is the real sad part, is that much of the burden of communicable diseases is avoidable. Many can be prevented or treated. And we're going to speak more about this in our next lecture.